Hi, I'm Dr. Sarath Balaji here. We are going to discuss about pediatrics question that were asked in the recently concluded INICET examination in the month of November. With respect to pediatrics, the questions are simple and straightforward, not that much complicated clinical based and not much complicated image based. And mainly the questions were asked in core pediatrics only. Let us go to discuss all those topics. A baby vaccinated at 14 weeks, which vaccine to be given next to route and when? So what are all the vaccines that are given at the 9th month? The vaccines that are given at 9th month are 1. What are all the vaccine? PCV booster, IPV booster, MR and JE vaccine. PCV is anterolateral thigh. IPV vaccine intradermal, MR vaccine subcutaneous, JE vaccine subcutaneous. What are all the routes? These are all the routes where these sites are chosen. So these are all the sites that are chosen. Your FIPV vaccine is given at left arm, whereas your MR vaccine is given at right arm. Your PCV vaccine is given at right thigh, and JE vaccine is given at left thigh. So what is the answer for this question? MR vaccine at 9th month is given in the right arm. I repeat, MR vaccine is given subcutaneously in the right arm. This is the answer to this question. Let us go to the next question. A 6-week-old infant developed fever after DPT vaccination. What vaccination should be done at 10th week? Remember, when you give DPT vaccination, there are chances for anaphylaxis, there are chances for encephalopathy, and there are chances to produce this neurological illness in a child with progressively neurological deficit. But this child developed only fever, which is not a contraindication for the next DPT vaccination. I repeat, the absolute contraindication for the pertussis component of DPT vaccination is: one is anaphylaxis, second is encephalopathy. Second is encephalopathy within 7 days of giving vaccination. One is anaphylaxis, second one is encephalopathy, third one is progressive neurological illness. Progressive neurological illness. These are all the absolute contraindications for DPT vaccination. The child developed only fever, so there is no contraindication for the next vaccination, DPT vaccination, given in the form of pentavalent vaccination at 10 and 14 weeks apart from 6th week. So give DPT vaccination because there are no absolute contraindications or no clinical feature suggestive of anaphylaxis, encephalopathy or progressive neurological illness in this child. So the answer for this question is give DPT vaccination. Third question. Assessment of perinatal asphyxia includes all except Apgar score of 4 to 7 at 5 minutes. Yes, it is included in the criteria for perinatal asphyxia. Cot pH of less than 7.2 indicates hypoxia and lactic acidosis. Yes. Hypotonia indicates that there is a multi-organ dysfunction involving neurological illness leading to hypotonia. So all these are included in the criteria of perinatal asphyxia, whereas hypocalcemia, one of the risk factor for hypocalcemia is perinatal asphyxia, but it is not included in the criteria of perinatal asphyxia. So assessment of perinatal asphyxia includes all except hypocalcemia. Next question. A child brought with 6 days of fever, conjunctival suffusion and strawberry tongue. The drug of choice is IV fluids, aspirin, cephalosporin and IVIG. So this case is dealing with a fever lasting for more than 5 days. along with the conjunctival suffusion in strawberry tongue. That means we are dealing with a case of Kawasaki disease. What other things that can be a manifestation apart from this mucosal involvement? In the first week, you will get a red maculopapular rash. In the next second week, you will get what? In the second week, you will get excoriations around the perianal area or exfoliation involving the nail bed. And the last point is single cervical lymph node of more than 1.5 centimeter. Fever lasting for more than 5 days along with 4 of the following 5 indicates it is a complete Kawasaki. Less than 4 indicates an incomplete Kawasaki disease. In this case, this is quite straightforward even though other 2 criteria were not present. So this is a case of Kawasaki disease and the drug of choice is IVIG. Yes, we know aspirin should be given for about 6 weeks, but the question is drug of choice. The drug of choice here is IV immunoglobulin 2 gram per kilogram over a period of 2 days. A newborn, next question. A newborn with respiratory distress, scaphoid abdomen and mediastinal shift. It means we are dealing with a case of congenital diaphragmatic hernia. The following should not be done. Increase in PEEP. When the child is having endotracheal intubation, you can give PEEP. Right? Bag and mask ventilation absolutely contraindicated because the air will go into the intestine which is present in the lungs, leading to compression of the lungs and it can worsen the scenario. So bag and mask should not be done. Oxygen through nasal tube can be given. Endotracheal intubation can be given. So the answer for this question, which one should not be done in a case of congenital diaphragmatic hernia, is bag and mask ventilation should not be done. Next question. A 9-month-old child brought by her mother with fever, cough, and a respiratory rate of fever 48 per minute, but there is no chest in drawing. What is the next step of management? We all know that pneumonia based on INICET guideline is divided into non-severe pneumonia. Non-severe pneumonia in turn divides into fast breathing pneumonia and the next one is chest in drawing pneumonia. Next is chest in drawing pneumonia. Fast breathing pneumonia, define fast breathing pneumonia, less than 2 months more than 60 per minute, 2 months to 1 year more than 50 per minute, and 1 year to 5 year more than 40 per minute should be called as tachypnea. But here this child is 9 months old. To say tachypnea, it should be more than 50 per minute, but here 48 per minute. So it is not included under pneumonia. So no treatment is required. There is no need for any medication apart from paracetamol. So this is not a case of pneumonia at all. So no treatment is required except paracetamol for fever. Next question. A child is brought with 3 days of watery diarrhea, vomiting and altered sensorium. All can be causes for altered sensorium except, yes, whenever a child develops altered sensorium, it can be a manifestation of severe dehydration or it can be a manifestation of hyponatremic dehydration, or because of dehydration there are chances for venous thrombosis in the cerebral vein. So all these are possibilities for altered sensorium in a child with diarrhea, whereas hemolytic uremic syndrome is a manifestation of dysentery and not diarrhea. And the manifestation of hemolytic uremic syndrome is sudden onset anemia, sudden onset thrombocytopenia, along with elevated urea and creatinine. Since this case is dealt with the watery diarrhea and not dysentery, and no feature suggestive of hemolytic uremic syndrome were given, The answer for this question, all the causes for altered sensorium except is hemolytic uremic syndrome cannot be a correct option in this. Next one, HEDAS. Assessment is done for what? Adolescent. HEDAS is mainly meant for adolescents. Okay. It includes suicidal tendencies. It includes so many things with regard to adolescent. Okay. It is not mainly concerned with the neonate or less than 1 year or under 5 years. It is mainly meant for assessment in adolescent clinic. HEDAS is mainly meant for adolescent clinic. Which of the following injectable vaccinations are given in anterolateral thigh? BCG vaccination intradermal left arm, MR vaccination intradermal right, JE vaccination subcutaneous, whereas PCV vaccination is given in anterolateral thigh. Next question. Slapped cheek appearance is seen in, you all know it is seen in parvovirus B19 infection. Slapped cheek appearance, it is a quite straightforward question. Management of DKA, what is followed? Start regular insulin at 0.1 units per kilogram with IV fluid infusion. Regular insulin 0.1 units per kilogram per hour after 1 hour of IV infusion and bolus of subcutaneous insulin. The main cause of death in diabetic ketoacidosis is your severe dehydration. That has to be corrected first. So 20 ml per kg of normal saline should be given. That should be followed by regular insulin. Right now, people have included subcutaneous insulin also. But for you people, the answer should be B. Correct dehydration first, followed by starting regular insulin after the correction of dehydration. Which of the following is not seen in Down syndrome? Hypothyroidism, yes. Hearing loss, yes. Short stature, yes. Whereas caudal regression syndrome is a manifestation of infant of diabetic mother. It is not a manifestation in Down's syndrome. Next question. The sweat and pancreatic levels of chloride in cystic fibrosis is, you all know, the chloride content in the sweat is increased. The chloride content in the sweat is increased. Okay, is increased. That's why your sweat chloride of more than 60 millimole per liter is considered as positive for cystic fibrosis, whereas chloride cannot be excreted in any other endocrine ducts, whether it is a pancreatic duct or whether it is a gallbladder duct or whether it is a bile duct. Chloride cannot be excreted, as a result of which water cannot go into the intralumen, as a result of which dehydration occurs, leading to intraductal plugging and leading to secondary pressure atrophy of the pancreas, leading to pancreatic insufficiency. So chloride levels are increased in sweat and decreased in pancreas. That is the answer for this question. A child with altered sensorium with the following values in the CSF examination. Protein is mildly elevated, glucose is little bit decreased and lymphocytosis. In bacterial meningitis, it is predominantly neutrophils, so it cannot be a bacterial meningitis. In tuberculous meningitis, proteins will be very, very high, but here just increased. So it is probably a case of viral meningitis with lymphocytosis, mildly elevated protein, and glucose is little bit decreased. Look here, glucose hypoglycemia in viral meningitis is less common. Only in 2 conditions of viral meningitis, glucose will be reduced in the CSF. One is herpes, second one is mumps. Here it is lymphocytosis, glucose is little bit reduced and protein little bit increase. Mostly this is a case of viral meningoencephalitis. Match the following. Autosomal dominant. What is autosomal dominant? Okay, let us see. Autosomal recessive is cystic fibrosis. Mitochondrial is Leber's hereditary optic dystrophy. X-linked recessive is Duchenne muscular dystrophy and autosomal dominant is myotonic dystrophy. This is quite a straightforward, simple match the following. With this, I am finishing this topic. Thank you.